Hey, good morning, everybody. This is Brittany with the Seniors Blue Book, and happy Tuesday. I hope everybody had a great holiday weekend. This morning, I am here drinking coffee with my friend Christie Castro from HomeWell. Good morning, Christie.
Good morning, Brittany. Thanks for having me on today.
Absolutely. You look very nice.
Even
it's
showered
the necklace.
Yeah, it's the necklace.
So I wanted to, a lot of people, of course, know you in our community, and we've done a video in the past kind of introducing HomeWell and what you do, who you are. But tell us, maybe this could be fun. Tell us something about yourself that maybe somebody, watching doesn't know. And then also we're going to get into some of the specific HomeWell programs that you guys offer.
So I have been in private duty for over 15 years, and HomeWell is my baby. It's actually my agency. I'm one of the owners here, and I'm really excited about that because I was able to bring many years of experience together to develop some programs and bring them out into the community to provide like high standards of care in private duty. Things that I've seen in the past that haven't worked that we can tweak and make better. So that's really basically what we're doing here at HomeWell, trying to provide that high standard of care.
Absolutely. And with some of the, maybe touch on just a few of the kind of an overview of the area you cover, the services that you provide.
So we are currently serving Manatee and Sarasota County, very soon to be serving Hillsborough County. What we basically do is we provide non-skilled private duty care. So we are not doing anything skilled with nurses. It's all home health aides and CNAs supervised by an RN. And our services are essentially in the home. We focus a lot on keeping people at home and independent, since I've not really met a senior who's like, I can't wait to go to the nursing home. So that's really what our primary focus is. We're really excited about a couple of programs that we offer that we think differentiate us from other people in the industry. One being LEAP, which is our Life Enrichment Activities Program. That program is designed to engage the senior. It's a lot like concierge caregiving, but it's where we find out all the likes, the dislikes, and the preferences of the particular client. Do they like to color? Do they like to garden? Do they like to go to museums? What are the things that they really love? And then we design our care plan around matching them with the caregiver who is going to really provide those quality engagements that they need. So we're really working on, especially with people with dementia and Parkinson's, we're really working on finding activities that meet them at their level that they want to do, so that every single day they look forward to meeting and seeing their caregiver.
It's so important to make sure that your caregivers and your clients click. I think that's something that can make or break somebody's, especially somebody who's maybe a first time using in-home care. Their experiences, especially that first time, is going to matter, and it's going to resonate with them. So like you said, being able to figure out, okay, they like building airplanes, or they like, model airplanes, or they like doing this, or watching, I don't even know, The Price is Right, whatever it might be in their routine throughout the day. It's so vital to success for caregiving.
It is. I mean, a lot of our LEAP program and a lot of our LEAP training is about how to engage. What I have found in the past is that caregivers, whether they're on their cell phone or they're just watching TV, there is sort of this wall, whether it's generational or cultural or whatever it is, between the two, and there's nothing for them to really engage with. So if we are going to watch Jeopardy, or we are going to watch The Price is Right, we sort of we coach and counsel the caregivers on talking about the program with the senior, engaging with the senior, answering the Jeopardy questions, and giving them that experience like they're actually with somebody and not just sitting alone in a room watching TV. But I really kind of discourage a lot of TV watching. It's not good for people to just sit and watch TV. So we do, take people on walks. Even in this heat, we'll try to do it early in the morning, but we try to do a lot of walks where we look at birds and we talk about, oh, what is that? And we try to encourage our caregivers that it's not just about the technical skill of changing someone or dressing someone or showering someone, because all of that stuff will happen. It's most important that there's a personal connection between you and your client, and that you can build a bond with your client, and that your client is comfortable with you providing the care, because it's not just giving a shower. It's not just sitting with someone and making sure that they're not going to fall, but it's also caring about what they care about and showing an interest in their life, their pictures, things like that. So we're really proud of our LEAP program. We've gotten a lot of positive feedback from clients who feel that their parents are receiving really good services. And so we continue to kind of roll that out and continue to grow that program. Lots of coloring, lots of museums. And of course, as the pandemic sort of things start to open back up with the pandemic, we'll see a lot more outings, going to the theater, things like that.
For sure. And I know, it's kind of speaking of the pandemic, and, we think about people coming out of the hospital and kind of what that process looks like. And even on a normal, before, let's just say BC, before Corona, we saw that transition from going from the hospital to home, there's an open window there for readmittance to the hospital. So how does HomeWell kind of assist with that transition? Is there a specific program that you guys have that helps clients be successful at home?
So our transitional care program, whether it be from the hospital or the nursing home, we call that Go Home Well, primarily because we want people to go home well. And what we are doing is we are providing them with some very basic pillars of care, which is nutrition and hydration, making sure that when they come out of the hospital, that they're eating properly, that they're properly hydrated, and that if they've been out of their home for an extended period of time, like been in rehab for 60 days, that we make sure that the refrigerator is cleaned out, nothing's expired, that we've refilled it with the proper food that they need, and that they're eating the diet that the doctor has prescribed them, whether it's low salt, low fat, no sugar, whatever that is. So that's part of Go Home Well. The other part is medication compliance, ensuring that they're taking their medications as scheduled and as prescribed by the doctor. We do have a lot of people who will say, well, that was $50, so I'm just not going to pick that up. So we try to follow up from the discharge planners at the hospitals and the rehabs to ensure that all of the medications are following them home. We ensure that they see their primary care physician. That's another part of Go Home Well, is that they get their first appointment right away with their PCP. And if they haven't seen their PCP, that we're setting them up with the PCP primary care physician almost immediately within the first week that they're seeing somebody. We also do a lot of just safety evaluations when they first get home, make sure that their Medicare home health company is set up, and that we're ensuring that their new change, whatever has gone on, if they had a fall preceding the hospital stay, or if they have a new diagnosis, that their home environment is well equipped and adapted to what their needs are. So we call that Go Home Well. It's been well received in the community because people really like the fact that we give you a report. So if you're the discharge planner or you're the family member, we're going to give you a Go Home Well report that says these are the items that we see as deficient. This is what we need to make changes on. And the caregivers are reporting in real time to the family and to the agency about what's happening in that transition home. We basically encourage all of our family members to keep track of their parents and their loved ones through our family room, so that they can see that the transition home is going smoothly, or that they can leave comments like, don't forget my dad can't have coffee, things like that. So we definitely utilize a lot of Go Home Well for many of our patients, or aspects of Go Home Well. Even if they haven't been in a rehab stay, there's a lot of really good components of that to private duty that are important, such as the nutrition and hydration.
Is there a minimum for how many hours each time you'll come in? I know you guys go up to 24-hour care, but is there a minimum?
4 hours.
Okay.
And
that's an appropriate time. People can you can do a lot in 4 hours. I think that's a great amount of time.
We can do a lot of care in 4 hours. There have been some instances when I have reduced that to 3, when there really was just not that great of a need and the person was able to do quite a bit for themselves. But yes, we do have a 4-hour minimum.
All right, perfect. And the other question I want to kind of flip over to is if somebody's well, we lost internet connection. And let's see if Christie, let's see here. I think I might have lost Christie. I know the other thing that we wanted to touch on was the employment side. So Christie is hiring for caregivers. So if you or if you have somebody who is in your family, loved one, or a friend that you know that is a trustworthy, reliable caregiver in it for the right reasons. Oh, I have Christie, I think, coming back on. Let's give it just one moment. Hey, Christie.
Hi. I don't know what
We're still
happened.
live. I'm not sure. It dropped on me first and then you, and I wasn't sure if you'd be able to get back on. So I was just sharing that you are hiring for caregivers, correct?
We are, yes. Our human resource director stays busy recruiting caregivers. We do pay our caregivers quite well, and we do have some incentive programs for them to keep them on board long term. But we are looking for the absolute very best. I call them home care superstars. We are looking for people who are available and flexible, and people who want to have quality engagement with seniors, not just people who can give showers. We're really looking for people who have upbeat, bubbly personalities.
Awesome. Well, thank you so much for coming on and sharing about the life enrichment programs that are so vital to the success, as well as all of your knowledge just in everything that you do. And I didn't realize that you've been in this because I actually, did you start this career when you were 5? Because I thought you were just like me. We're in our like early 20s, right?
Yeah, I just turned 21 last week. Right. No, honestly, it was not my first choice. I was going to be a teacher first, and then I did student teaching and was like, oh, I'm not going to do that anymore.
No, you're perfect in your role. And again, if you are somebody who either has a friend or a family member who's looking to be a caregiver and has that I'm just going to call it a bright heart that's going to be a superstar, give Christie a call. I'll put your information, Christie, in the post, of course, with this video. And thank you again for sharing your time with us this morning.
Okay, thanks. Have a good day.
Have a great day.
Bye-bye.